Hi, my name is Dr. Chan, Dean of Admissions at the University of Utah School of Medicine. Congratulations on being offered an interview. You might be thinking, what's my interview going to be like? Well, we call it Assessment Day. I'm here to talk to you what to expect and how to get to where we're at. So first of all, what's the goal? We get to know you and you get to know us. That's the goal of Interview Day. We recently moved our offices. So now where are we located? We're at the south end of the University Hospital in the Health Science Education Building. If you look on the map here, you can see admissions with an arrow pointing to it. We're on the 5th floor of the Health Science Education Building, Suite 5900, 5900, the very south end of the building. Parking options. You can park in the University of Utah parking. For those of you who are not a student here at the University of Utah or employee, you're free to park in the visitor parking. However, you can park a little bit closer to our office. We have the Health Science Parking Center available for a fee, $2 an hour, $20 per day. Fortunately, we do not provide validations for anyone. And go to map.utah.edu to zoom in for a more detailed view of the parking options. General tips as you prepare to visit us. First of all, dress professionally. Comfortable and weather appropriate shoes are advised. You'll be walking around a lot. You'll get to meet a lot of people. So again, speak professionally and act professionally. A general tip is remember, the whole day is your interview day, not just the time you spend with the interviewers. Some more tips. Please arrive on time. Our doors will open at 7:15 and orientation begins at 7:30. I would recommend leaving early in advance. Make sure you know how to get to our medical school and give yourself some time for parking and how to get up to our office. We interview on most Mondays and Fridays from September through February. We usually interview 16 applicants per day. What else should you expect? There's not going to be that much downtime. And we'll escort you to each activity, so don't worry about familiarizing yourself with how to get where and different activities like that. You'll get a tour with first-year medical students or staff. You'll have lunch with second-year medical students, and you'll interact a lot with our faculty, staff, and other medical students. So what types of assessments will you experience on your interview day? We do the MMI, multiple mini interview. The way to think about this is like speed dating. So essentially, you'll encounter 8 different scenarios, which are ethical in nature, posted outside each station. There'll be 2 pieces of paper on the door. The first piece of paper will be blank. It'll be covering the second piece of paper. On the second piece of paper will be a question, a prompt, a scenario, a picture. You'll hear a bell. That means you lift up the first piece of paper, and you'll have 2 minutes to read the scenario. Organize your thoughts. Think about how you're going to answer it. You hear another bell. That means go into the room. You have 7 minutes inside the room to talk about with the evaluator. Now, this is not meant to be a monologue. You're not going to talk at the person for 7 minutes. They're going to challenge your position. They're going to ask follow-up questions. It's much more a 7-minute discussion. At the very end, you'll hear another bell. That means time's up. Wrap it up. Finish your final thought. I recommend you do not walk out right in mid-sentence because you have 1 minute to make it to the next station. And literally, the next station is 4 or 5 feet down the hallway. It does not take 1 minute to get there. I've timed it. So when you hear that final bell, that means wrap it up, and you'll have time to make it to the next station. So with the MMI, the people in the room do not have access to your applications. They don't really know who you are. So when you go into each room, you can introduce yourself. Why are we doing the multiple mini interview here at the University of Utah School of Medicine? Well, first of all, it reduces the variability of the experience. With traditional interviews, it really depended on who you got and how they felt about you. We learned more about the interviewer than we did about the interviewee. With MMI, everyone has the same experience. Everyone will have the same scenario and have the same person evaluate them. That really cuts down an inner variability between the reviewers. There's a lot of research correlates MMI performance with interacting with patients and clinical skills within medical school. And applicants feel this is just more fair. We've conducted a survey year after year when we've done the MMI, and applicants universally feel that this is a more fair experience towards them and their ability to get into medical school. Lastly, I call it the power of redemption. So with multiple stations throughout the day, an applicant can do poorly at 1 station, perhaps 2, and that's all right. You redeem yourself. You find that power within, and you do better at the next station. So I call that the power of redemption. We also have at our medical school, as part of your assessment day, something called this SJT, the Situational Judgment Test. This is very similar to the MMI. With the MMI, we give you an ethical situation and you have to talk through it. With the SJT, we give you an ethical situation and we created a multiple choice test. So first of all, this is not a test of your scientific or clinical knowledge. We're not going to ask you to regurgitate the citric acid cycle, the Krebs cycle. These are much more ethical, situational-based questions. So why are we doing this? Why are we doing the SJT here at the University of Utah School of Medicine? This is used extensively in the European medical education system. It's actually quite advanced within Belgium, the UK, and this assesses non-cognitive traits and attributes. Things like empathy, professionalism, how do you make decisions. So this is probably going to be part of the MCAT in a few years. And we're very excited about this. This again shows the innovation we use in admissions at our medical school. The last part of your interview day or your assessment day will be something called the Standardized Video Interview, or SVI. Now, this is a little trick. You should be doing this before you come to your interview day. You'll be receiving an email with more information regarding the SVI if and when you're invited for an interview here at the University of Utah School of Medicine. So you complete this before you come to your assessment day. Essentially, this is an asynchronous recording of verbal responses. So you'll probably see a picture of my face or my voice asking you a question. For example, why do you want to be a doctor? And then through your computer or your phone, but I recommend a computer, it records your 2 to 3 minute response. There's also written responses as well, where again, you'll be prompted with a question and you'll type in your answer. And this should last anywhere from 20 to 30 minutes total. So why are we doing the SVI? Well, the standard video interview is being used more and more in residency program selection. And this is actually quite a common technique used in the biotechnology and corporate world. Human Resources uses this a lot. And I can tell you right now that telehealth and telemedicine are growing fields within our healthcare system. Physicians are required to communicate electronically through their computer, through email, through video feeds with patients out there in the field. This is more fair with different reviewers. So the way to think about this is we used to have traditional interviews, but this way, instead of having one person interview you and grade you, we can have multiple people review your standard video interview questions. Again, this goes along with how we try to innovate in admissions in our medical school program. So at the very end of your interview day, expect to have a closing. We'll have one of our staff members come out and discuss the process of what happens next. We'll also talk about financial aid, a presentation and questions, and then answer any other questions you may have about the University of Utah School of Medicine, the admissions process, or what to expect next. So please don't hesitate to ask our admissions staff any questions. Either email us before your interview day if you have any questions, if we didn't answer them in this little presentation, or during your interview day itself. If you have any questions, pull aside one of our staff and please ask them. Again, we're very excited for you to interview here at the University of Utah School of Medicine. I look forward to seeing you on your interview day. Thank you.